For the work that I do with the United Nations Office on Drugs and Crime, we have a global program that we have worked with the World Health Organization and civil society partners, in particular UICC. And what we're looking at is focusing on three different areas. The first area that we look at is, does the legislation and the actual policies match? So if the legislation we find is most of the time not so bad and it matches with the international drug control conventions, but the policies and how they're interpreted, even in the national level, could be different. We also look at building capacity for doctors, nurses, pharmacists. All of the parts of the healthcare system should be functioning at that patient-centered and high-quality standards element, even when it comes to essential medicines, which might, in this case, relate to pain relief. And the third area that we look at in the global program, how do we access or manage a supply chain? Now, they're in the supply chain shaped by the International Drug Control Conventions. However, each government has the opportunity at the national level to also impose the more controls on that supply chain. And oftentimes we find that the supply chain becomes so complicated that it's very difficult to manage the supply and demand within a medical setting, or what we call a regulated setting. And so rather than make those medications available, we find that many countries around the world don't have enough of the medicines available. So even if they want to use those medicines appropriately for cancer patients, they just don't exist. They are not in stock. And it's very difficult, and it's a very difficult balance to really work through that supply and demand and make sure that you don't have too much stock available, but that you have enough stock available that it can be used for medical purposes and that we prevent non-medical use.